Health Podcast by Jenna McCullough and Rajavi Saxino.
Table of contents: choking, very deep wounds, frostbite, first-degree burn, poisoning, leg injury, heart attack, hyperthermia, auto accident, fire.
Choking. Definition: having difficulty in breathing because of blocked airway. Steps: 1. Ask person, "What is your name?" or "Are you choking?" If they cannot answer, perform abdominal thrust throughout until the object comes out. Do not perform abdominal thrusts if person can speak because they can cough it up themselves.
Very deep wounds. Definition: a wound that is very deep and cannot be treated using just water and a Band-Aid. Steps to treat a very deep wound: Call 911 immediately. Apply gloves onto your hands. Apply direct pressure onto the wound until help arrives. Tip: do not move the person unless it is life or death situation.
Frostbite. Definition: injury to the body tissues because of extreme cold. Steps: get the person out of the cold immediately and into a shelter. 2. Put blankets or more layers of clothing on to attempt to get the body temp back to normal. Put the person's affected frostbite area, if possible, into warm water. Tip: this usually is not a situation you need to call 911 unless it is a very severe situation.
First-degree burns. Definition: the least severe and most common type of burn. Steps to treat a first-degree burn. Step 1. Hold the burned area under cool water, not cold. 2. Cover the burn with a gauze bandage. Tip: don't put the butter or egg whites on the burn or break blisters that may form.
Poisoning. Definition: when a substance harms or causes people or animals to become very sick and cannot function properly. Call 911 or Poison Control Center immediately. Answer any questions with as much detail as possible to the Control Center or 911. 3. Follow instructions you receive and do nothing else until help arrives. Tip: all of this can be avoided if you keep dangerous liquids away from where they can be a threat.
Leg injury. Definition: when your leg is injured during any kind of physical activity. Steps to treat a leg injury: if leg injury is serious, call 911 or for help. Do not move a severely injured person unless necessary, and if it is, use a splint. 3. Rest and apply ice to reduce swelling. 4. Elevate the leg on pillows above the heart. Tip: remove all jewelry around the injured area in case it starts to swell up.
Heart attack. Definition: an episode of heart failure when the heart stops beating or has an
abnormal beating pattern. Steps: call for help or 911
immediately. If they stop breathing, then begin CPR to keep the blood circulating. 3. Take the victim to the ER and yourself if you are in the middle of nowhere and this is your only choice. Tip: quick action can save lives. Start CPR as you can confirm that they are not breathing.
Hyperthermia. Definition: when the body temperature is greatly above normal. Steps: 1. Reduce body temperature by cooling the body with water, blowing air on the person, or wrapping them in wet sheets. Whatever you do, make sure it cools the body temperature. 2. If the above methods don't work, then you should seek medical attention. Call the doctors or 911. Tip: hyperthermia is the exact opposite of hypothermia, so do not give the same treatment for both since it will make one of the cases worse.
Auto accident. Definition: when a person or animal is in a car accident, meaning the vehicle did not function properly or another vehicle caused damage. Steps: call 911 immediately. Do not get the person or people out of the car unless it is a life or death situation. Stay with the victim and try to do whatever you can do to help. Tip: this will be a lot easier for yourself and the victims if you stay calm throughout the incident.
Fire. Definition: a situation where an item/building/person has caught on fire or is aflame. Steps: if even slightly major, call 911 or the fire department immediately. If a person is aflame, tell them to stop, drop, and roll. It helps if you put a blanket or something to stop the oxygen flow to the fire. Get a fire extinguisher, preferably a universal one, and use pass. Pass is pull the pin, aim low, squeeze the trigger, and sweep side to side. Tip: fire needs oxygen to keep going. If you can cut off the oxygen flow, then it will make the situation a lot better because the fire will be gone quicker.